Cranial nerve examination, how you examine the each cranial nerve. In this lecture, I'm going to discuss 1 to 6 cranial nerve. First one is the olfactory nerve. Its function is smell. So it is a sensory nerve that helps to smell something. So you ask a patient to smell something to the nostrils, and this way you check the patency of the nasal passages, while the person who examines can comprise the nostrils. When the olfactory nerve is damaged, ability to smell something is lost. A condition which is associated with the cranial nerve, that is olfactory nerve, it is anosmia, when you have lost the ability to smell one or more things. So when your olfactory nerve is damaged, ability to smell something is lost. Another is optic nerve. Function is visual field and the visual acuity. First, which you check is the visual field. You examine the patient and you ask the patient to cover the one eye while the other eye is examined. The opposite eye is examined, and then the examiner uses any object to check the visual field. Like your object is moved in all the four quadrants, upper quadrant, lower quadrant, and from side to side, and you ask the patient wherever he sees the object will point out. Next is the visual acuity. What happens in the visual acuity? Your each eye is tested separately. Like it is used to check your eyesight. So visual acuity is measured using a Snellen eye chart. It measures how well a eye can see at a distance. So your examiner uh, asks the patient to read the letters from first the bigger one and then the smaller letters. Next is a oculomotor nerve, pupil reaction and the eye movement. First one is the pupil reaction. So when your pupil reaction is disturbed, so your pupil constriction is basically lost. So what examiners do, he asks you to follow a object or follow a finger, and the examiner's finger just move towards your eye, and as a result what happens, the pupil constricts. That is a normal. But when the pupil is affected, so it dilates and light reflex are impaired. So this is a pupil reaction when the pupil reaction is disturbed. Next is a eye movement. So when your eye movements are disturbed, what happens first? It can may result in your paresis when there is a muscular weakness. When the nerve is damaged, it may result in a muscular weakness. Oculomotor supplies your different muscle that controls your abduction and the outward movement. So when your oculomotor nerve is damaged, your adduction and the outward eye movement is disturbed. It may lead to apoptosis, which is a dropping of the upper eyelid, sometimes known as the lazy eyelid. And another condition it may develop is diplopia. What happens in diplopia that causes a double vision? And it is most commonly common in patients with a transient ischemic stroke. The chances of developing diplopia in these patients increases. Next is a trochlear nerve. Trochlear nerve controls your eye downward movement. So your trochlear nerve supplies the superior oblique muscle. So it controls the downward movement of the eye. So when your trochlear nerve is impaired, the downward eye movement, movement of the eye is impaired. So you ask the patient to follow the finger or any object as you move it downward. So a patient will be unable to follow the object and unable to move his eyeball downward. So your trochlear nerve is impaired. Next is a trigeminal nerve. Sensation, forehead, cheek, chin, and clench the teeth. Like trigeminal nerve is the largest of all the cranial nerves. Like it has both sensory and it has motor fibers as well. So it's known as a mixed nerve. The sensory part supplies the face that control touch, temperature, and pain, and the motor part performs your mastication. So sensory examination is done by doing a lighter using a cotton, and you ask the patient to close the eyes, and they respond whenever they feel a touch. And motor component is examined. You ask a patient to clench a crease. At the same time, you palpate the master and temporalis muscle. Next is the abductor nerve. Abductor nerve controls your lateral eye movement. So it supplies the lateral rectus muscle. So it abducts the eye. It allows uh, the eyeball to move away from the nape line. So examiner move the pen or a finger towards the lateral side, or simply you ask a patient to look to each ear. So a patient with the abductor nerve impairment, you will unable to do this.